guys, it's Dr. Johnny Nelson of Raleigh-Durham and the Bone and Joint Surgery Clinic, and this video is about what to expect on the day of a shoulder arthroscopy or a shoulder scope procedure. So on the day of a shoulder scope procedure, as I mentioned in some other videos, this is an outpatient surgery, meaning that you're likely going to be going either to a surgery center or a hospital. Usually most scope surgeries are nowadays done at what's called a surgery center, which is essentially a hospital, but it's a very small hospital where patients are sent home that same day. So most likely you will be going to a surgery center for your surgery, and you will be going home that same day. Now the important thing to understand about a shoulder or a scope procedure is that you will need somebody to drive you to and from the surgery, right? Mainly because when you go home, you're going to have medications on board still in your system from the surgery, and it's not safe for you to drive. So somebody will need to be there, and they will need to be there for you for about 24 hours after the surgery. So just keep that in mind. Also, on the leading up to the day of surgery, and I did want to mention preoperative Tylenol, right? So preoperative Tylenol, studies have shown us that patients that take 3 doses of Tylenol, 1,000 milligrams of Tylenol, again, if safe by your according to your primary care doctor. If you take that in the 24 hours leading up to your surgery, so I tell patients take that every 8 hours times 3 doses, the last dose being right before you leave the house to have your surgery. So that morning, before you leave the house to go to the surgery center or hospital for your surgery, you take that last dose of Tylenol. So that's 3 doses, 1,000 milligrams. That's been shown to lead to less pain after the surgery, right? So even if you have a nerve block and you follow all of our instructions, patients who do that before surgery have been shown, according to our literature, our studies, our science, that they have less pain afterwards, right? So that's something that as long as you can take Tylenol, even if you feel Tylenol does nothing for you, it does have this effect to lessen your overall pain levels after the surgery. So when you arrive at the surgery center, you're going to check in there. Somebody will call you as well. The day before, maybe 1 or 2 days before, they're going to call you. So be expecting a phone call. Make sure you have your phone on. And they're going to tell you all the details you need to know. What time to arrive, where to park, what to bring, what to wear, what kind of clothes, what jewelry to take off, when to stop eating. So they'll give you a lot of those details and kind of confirm all those details for you. So expect that phone call. When you arrive, they're going to check in, and from the point you arrive, there's a little bit of paperwork to fill out. Now, from then on, you're going to get a lot of questions from a lot of different people. It's very important that you're patient with this process. So we have a lot of safety mechanisms in place with surgery, and a lot of those involve asking patients and confirming with them multiple times. So don't get frustrated with the nurses, with the staff, with the anesthesia doctor when we kind of ask you exactly what we're doing and to confirm that, because that's all part of a safety culture that we have to make sure that no complications happen during the surgery. So you're going to be asked a lot of questions, and you'll have to obviously sign some paperwork, and there'll be nurses and people going over different things with you. Now in that preoperative area where you're getting ready for surgery, 2 different doctors will see you. Number 1, the anesthesia doctor will see you. And that anesthesia doctor will most likely be doing what's called a nerve block, right? Now, typically shoulder scope surgeries are done with a nerve block and also with sedation. So in the other arm where you're not having surgery, they will put an IV. And through that IV, they're going to give you medicine to make you sleepy so that during the surgery, you will be napping. Typically, you will not have a tube down your throat. Sometimes that happens, but for the most part, most patients don't need that tube down your throat, what's called general anesthesia. They just get some sleepy medicine to kind of make them take a nap during the surgery. So you will be asleep during the surgery. But we also do what's called a pain control block or a nerve block in your shoulder. And that not only helps you stay comfortable during the surgery, but also will keep you comfortable for even several days after the surgery. And that usually is done by the anesthesia doctor in that preoperative area. And he'll talk to you more, or she will talk to you more about that procedure and that nerve block and the risks involved with that. And then of course I will see you, and I'm going to confirm the plan with you. I'm going to make sure we're all on the same page about exactly what's going on in the shoulder, what needs to be performed, what my surgical plan is. I will mark your shoulder to make sure we're working on the correct site and the correct side. That's also part of that safety culture that we have. And then from then we go back to the operating room. Right? And essentially I will do the procedure. Just briefly, because everyone's a little bit different, you will be placed on a special operating room bed where you'll actually be kind of sitting upright. Your head will be padded, put in a special little holder. You're going to be taking a nap during the surgery, and then we clean your arm up very, very well with a special cleaning solution, and I will perform the surgery. Now, when you come out of the surgery, you're going to have a dressing on your shoulder, so consult the other video of healing after shoulder surgery to learn more about that dressing and when it comes off. But you will also be in your sling. So when you come out, you're going to have that dressing on, you'll be in your sling, and you go to what's called the post-anesthesia care area. So that's called the PACU. It's basically where the nurses make sure your vital signs are doing okay and you're recovering from that surgery and that anesthesia well and you're recovering safely. At that point, your family can come back and see you, whoever's driving you home. And the nurses just want to make sure that your pain is controlled. They want to make sure that you're waking up okay and your vital signs look good. They're going to answer any questions that you have about the healing process, and usually they'll go over my instructions just to make sure that you don't have any last minute questions about your healing process at home. And from there, they will discharge you home. And so that's basically the day of surgery in the nutshell, right? So if you have any questions about that, obviously everyone's a little bit different in terms of where they have the surgery. All these details can be a little bit different for everybody, but certainly if you have any other questions, don't hesitate to ask us. I hope this video was helpful, and we will see you around. Bye-bye.